Welcome graduates, family and friends, faculty, and our College of DuPage administrators to the virtual pinning ceremony of the Spring Nursing Class of 2021. This academic year was affected with the current health crisis, yet our nursing students persevered to complete their education. Today, we are celebrating their accomplishment, a formal nursing pinning ceremony commemorating their completion of the associate degree in nursing program at the College of DuPage. Please join our graduates for our national anthem to be sung by nursing graduate Stephanie Welker.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watch were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say, does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Thank you, Stephanie. Now I'd like to take a moment to thank individuals for their leadership and support this year. Dr. Brian Caputo, President of the College of DuPage. Dr. Mark Curtis Chavez, Provost of the College of DuPage. Dr. Lisa Stock, Interim Assistant Provost of Instruction. Mr. Jim Bente, Vice President of Planning and Institutional Effectiveness. Dr. Diana Del Rosario, Assistant Provost of Student Affairs. And Mr. Walter Johnson, Vice President of Institutional Advancement. I would also like to thank our COD staff members who have played an integral role in our students' progression in our nursing program. Jennifer Chavola, Nursing Program Support Specialist. Pam DiNucci, Administrative Assistant. Melissa Erickson, Simulation and Lab Manager. Christy Calderaro and Linda Henson, Simulation Technicians. We would also like to thank our nursing program chairs of the Associate Degree Nursing Program, Professor Dr. Lorinda Dixon, Professor Dr. Janice Miller, and Professor Maureen Waller.
I would like to thank all our adjunct faculty and now our full-time faculty. Julie Alvin, Sarah Bourne, Judy Lau Carino, Dr. Lorinda Dixon, Dinopolis Galvin, Julie Garcia, Donna Canick, Ann Copel, Melissa McGovern, Rosa Colella Melky, Katie Taylor, and Maureen Waller. A special thank you goes out to Jim Nocera, Corey Kyle, and the media team for their assistance in putting this virtual pinning together today. I'd like to take a moment to share a brief history of nursing and the nurse pinning tradition. Florence Nightingale, named for the city where she was born in 1820, Florence, Italy, was an English nurse who trained and led nurses during the Crimean War in the mid-19th century. She worked to improve sanitation in hospitals, identifying the distinct correlation between cleanliness and improved health. And the end of these practices, which she implemented, reduced the death toll by 2/3. As a result of Florence Nightingale's influence, The importance of nurses training was recognized and hospitals began developing nursing programs. Known as the Angel of Crimea, Florence Nightingale was awarded $250,000 by the British government, which she used to establish St. Thomas's Hospital and the Nightingale School of Nursing in London. Graduate nurses of the Nightingale School were awarded a badge with a Maltese cross as they completed their studies. Schools of nursing evolved, and eventually each school of nursing designed and awarded a customized pin to its graduates. In the United States, the first pin presented to a graduating class occurred at Bellevue Hospital in New York City in 1880.
Our graduate nurses have received their COD nursing pin that continues to be worn by graduates of the COD nursing program for nearly 50 years. We acknowledge COD nursing graduates who have returned to teach at the College of DuPage. Professor Rosa Kalala-Melky and Professor Dr. Janice Miller and Dr. Anita Saravanan. Later in the ceremony, nursing graduates will join with all registered nurses here today to recite the Nightingale Pledge, which unifies all nurses. Now invite nursing graduate Tony Badway, chosen by his class, to give the student class address, followed by thoughts from Dr. Janice Miller, chosen by this class, to deliver the faculty address.
Hello, I am Tony Badway, and I am president of the Alpha Delta Nu Nursing Honor Society. I have been privileged to work as a professional tutor with the College of DuPage, and especially privileged to be a part of this outstanding nursing class of 2021. I am so honored to be given this opportunity to speak to you at one of the most important moments of your lives. Congratulations, you are about to become nurses. You won't have to worry about what to wear for the rest of your lives. All right, you still have to pass the NCLEX, but I know you're going to be successful. After all, nothing can stop this group, not even a worldwide pandemic. It is so hard for me to describe in words how brilliant this group truly is, but I'll try. The cohort is just bursting with personality, heart, compassion, resilience, and drive. Everyone brings something to the table, and many of you have helped me throughout this adventure. Let me share a few special moments that I've encountered with my cohort. One of you, who is about to be married, taught me how to use custom quizzes to tackle those devious EAQ assignments. FYI, they're all due in 1 week, so get to it. Another fellow student showed me how to take a manual blood pressure when I had become a bit rusty. I think you even discovered that I had my stethoscope on backwards, which might have explained my difficulty. One of you taught me everything you could possibly need to know about urinary catheter insertion. The key is making that cute little garbage bag. I'm thrilled to announce I just inserted my first catheter last week, and it went as good as urinary catheter insertion could go. To my surprise, the patient was emphatically thanking me afterwards, despite the uncomfortable nature of that procedure. One of you taught me how to make perfect APA 7 citations on a group PowerPoint presentation in MedSurg 1, and another fellow classmate showed me how to use the annotate function on Zoom, which allowed me to draw on one of the faculty's PowerPoint slides during live remote lecture. That helped me illustrate a question. On another occasion, I was so thankful I met with a fellow tutor as I was preparing for an important maternal child exam. She really helped me add crucial points to my score. Now, this is just a short list. Most, if not all of you, have helped me in some form. Whether it was asking an important question in class, or giving an enlightening presentation, or sharing your important experiences in clinical or at work as a CNA, LPN, or medical assistant. I thank you all for this, and I know that you have contributed to making me a better nurse. I'm amazed at the sheer amount of information we were able to absorb over these past 2 years, and even more amazed that our level of critical and analytic thinking has elevated so much over such a short period of time. I remember during the first 8 weeks of first semester wondering, how am I going to get to the level of the students who were in third and fourth semester? They knew so much, it seemed like they were a decade ahead. Seeing them practicing hat skills in the hallways was even more intimidating. There were just so many steps and so many skills to learn. In my first semester of the program, some of us had a nursing professor that instilled in us the confidence and faith that we would get to the finish line. She often addressed us as nurses, even though we were just beginning our journey. This really set a positive tone to start nursing school, and this theme continued with all of my professors without exception. It is a little known fact that we were forced to learn remotely for a period of time that started halfway through our second semester. This was tough. The absolute worst part for me was not being able to be around you. Every day I had looked forward to seeing you in class, in the hallways, and in studying in the common areas. Sadly, just like most of the world, we were separated from our friends, families, and colleagues in social distancing efforts to fight this virus. This brings me back to the faculty. The pandemic proved how deeply the faculty and staff cared for the students. Every professor stepped up and way out of their comfort zone to adjust to the new virtual reality we faced. All in all, we reached our goal, even if we had to do a few more case studies than we would have liked. And what better example of the faculty and staff's commitment to our success as their recent triumph in clinching our preceptorships in the 11th hour. I think it's safe to say that the majority of us did not expect to have this opportunity due to the pandemic. Nevertheless, like true nurses, the faculty determinedly advocated for us. To me, this was the crowning achievement of the professors and staff, further reflecting their unwavering commitment to this class. Now, I have been privileged to be a GSG tutor over 4 semesters, mostly helping nursing students understand content for pathophysiology, pharmacology, and dimensional analysis, basically all of your favorite subjects. I would like to pass down a few words of wisdom on how to prepare for nursing school exams. These are, in fact, gathered from my own past mistakes. Number 1, on a diet question, never select the bacon sandwich. It's never the right answer. Number 2, make sure the patient was assessed before defibrillating. A lead may have fallen off. And number 3, never give potassium IV push. Now, moving on, I want to say something very important to each and every one of you. You have earned this pin. You have worked diligently and gave your best efforts. You belong here as soon-to-be nurses. So may I say a few words of encouragement and advice. First, be confident in yourselves and don't be afraid to ask questions. Second, advocate for your patients. Part of advocacy involves providing freedom from suffering. I recently had what appeared to be a nonverbal patient with liver disease in the emergency room who was continually groaning and attempting to reposition himself. I stayed with him after my preceptor left the room and repeatedly tried to communicate. Within just 5 minutes, I was able to get a few words out. He had 8 out of 10 pain in his lower back. Those few words allowed us to obtain orders for pain medication that brought down his pain significantly within 30 minutes, and this alleviated his suffering. Third, do the right thing. Report observed or suspected abuse of children and the elderly. Don't do it just because it's the law. Do it to protect our most vulnerable populations. Finally, I have just a few more words for you. Treat the patient, not the disease. Be committed to lifelong learning. Be a proud member of professional nursing organizations. Strike the word why from your vocabulary when conversing with your patients, but use the question why to guide your assessments and interventions. College of DuPage bestowed us with critical thinking and analytic skills that will serve us and our patients very well in the coming years. But much beyond that, we care. I, for one, would take comfort to know that one of you were caring for my loved ones, because your hearts are in the right place and you will give all of yourself to their care. So go now, pass your NCLEX and share some of your greatness with the world. Thank you and congratulations to you all.
Thank you so much for the honor of speaking to all of you, the nursing class of spring 2021. I would like to say a heartfelt congratulations to each one of you, and I know that I could speak on the behalf of my colleagues. You are a very unique class who persevered to complete your nursing education under the most difficult circumstances, a global health crisis. When the College of DuPage shut their doors last March of 2020 due to the crisis, you all made a decision to continue your program and adapt to a virtual format to continue your studies. Little did you know that this crisis would be a time of isolation and fear of the unknown for the world. Our environment, finances, family, children, and social events were deeply impacted. You missed significant moments, weddings, graduations, birthdays, holidays, special vacation times, and time with family. Some of you lost loved ones or a friend to the virus or by other means, while others gave birth during this past year. All this happened over the last 12 months, enduring much stress and anxiety. But you all made a decision in March of 2020, and I believe that it was with God's help that you continue to complete your dream to be a nurse, and you have sacrificed much. I would like to take just a few moments to impart some thoughts that may prepare you for your future profession. But before I do, I would like to tell you a story that I have shared many times in my life. When my grandfather learned that I wanted to become a nurse, he sent me a letter from the Philippines. He wrote, "You are about to embark on one of the most noblest professions." As a high school graduate, I took his words very seriously, and I made the decision to work hard to reach my goal. So I would like to piggyback on my grandfather's words and say that nursing is not only a noble profession, it is a service unto God. These were words of Florence Nightingale. If we ponder on what that really meant, you just need to look back in history to the men and women in the nursing profession who have given their lives to serve others, demonstrating care and dedication. They could not have done their work without purpose or in their own strength. It is this high character quality in the profession that defines nursing, serving under the posture of humility. This was the year that the world recognized the healthcare team, especially nurses, who were dedicated to come into work under the pressures of a crisis because they wanted to help those who were ill. Some nurses even succumbed to the illness and even returned to work because they were dedicated and committed. Some of you have worked alongside them as patient care technicians, and you continued your classes at the college. You have witnessed nurses come into work willing to serve and maintain their position to perform their duties they have always done, even before there was a crisis, because this is what they were trained to do. In the past year, you have seen the courage of nurses working tirelessly, willing to serve unselfishly. You may ask yourselves today, am I ready to take that challenge? Ready to take the risk to work on the front lines for the sick, caring for the sick, regardless of self? I believe you're ready. Nursing class of 2021, you have demonstrated strength and resilience during these past several months. Despite the barriers that you've faced in finishing your education, you were willing to complete your studies, learn nursing skills, and adapt to online testing and attend virtual clinical lab and simulations. Who would ever had imagined? You made it, and we can now breathe, remember, and even laugh Thanks for allowing the faculty to share their war stories with you. I believe that we just wanted to let you know how we survived our experiences in the trenches. We could also look back and laugh, especially when we asked you to perform return skill demonstrations using household items on Zoom. On a lighter note, I believe we can reflect upon the positive things this past year. Maybe you saved money on gas, your families grew closer, you learned to cook more at home, you managed to still hang out with your nursing friends, even if it was by Zoom. But in a greater sense, this past year, when time stood still, we were all forced to examine our lives and prioritize what was important. Nursing school was on your bucket list, and we can only express deep gratitude for your flexibility, patience, and endurance during this time. I would be amiss if I did not include a time to reflect about your family, friends, and children today. They have been your greatest cheerleaders, supporting you to reach your goal. We know that it was their prayers and sacrifice as well, and so we want to honor them. Your family may have brought you Happy Meals, did a Starbucks run for you, or took the kids out of the house so you could study. So families, husbands, wives, parents, the nursing department is giving our students back to you. Our dedicated faculty have trained and invested their time and wisdom to prepare this graduating class for their future profession. We are grateful for the opportunity to help them learn the art of nursing. This was, of course, a selfish task because we know that our students may be taking care of us or our loved ones someday. It's true, and we have the confidence that they will do their very best. As I had mentioned before, the pandemic continues to bring much fear around the world. People wonder if they can ever regain their health and live their lives as they had been. Nursing can be part of the solution to bring change, but most of all, hope to those in need. So be encouraged. Florence Nightingale stated, "How very little can be done under the spirit of fear." That should be a charge for the class of 2021. You are called to demonstrate a higher level of service. You are our future. We wish you the best and congratulations.
At this time, I invite Professor Maureen Waller for the Alpha Delta Nu National Honor Society induction. Maureen will discuss Alpha Delta Nu and read their names.
Good morning. My name is Maureen Waller, and I have the honor of being a co-advisor along with Professor Katie Taylor of the Rho chapter of Alpha Delta Nu. Alpha Delta Nu is the National Honor Society for Associate Degree Nursing, and the College of DuPage has had a chapter of Alpha Delta Nu since 2012. In order to be inducted into Alpha Delta Nu, students must have an overall GPA of 3.0 or higher in all courses required for the Associate of Applied Science degree in nursing. In addition, students must have a B or higher in all courses that have a nursing prefix and be in good standing in the nursing program. Lastly, the students must perform service hours in their final semester of the program in order to be inducted. This semester, the students did a variety of projects, including serving as registrars for senior citizens for a COVID vaccination program, handling registration at an actual COVID vaccine clinic, and also doing EKGs at Young Hearts for Life. I'd now like to introduce the students who are going to be inducted into the Rho chapter of Alpha Delta Nu this morning. Tony Badway. Katie Shamey. Olgina Gingy. Kayla Hull. Kathleen Krieger. Jade Maestas. Alexandra Pizbailowski. Kavita Sangalj. Rokeya Shahada. Kimberly Selecki. Sally Tekpenekdal. Maria Villagomez, Anthony Wenzel. Congratulations to all of the inductees into the Row chapter of Alpha Delta Nu and to all of our graduates this morning.
National Student Nurses Association mission is to mentor students preparing for initial licensure as registered nurses and to convey the standards, ethics, and skills students will need as responsible and accountable leaders and members of the profession. Founded in 1952, National Student Nurses Association is a nonprofit organization for students enrolled in associate, baccalaureate, diploma, and generic nursing graduate programs. It is dedicated to fostering the professional development of nursing students. These students were elected by their classmates to lead and represent their class. Besides contributing to planning this day, they each had to complete 6 volunteer hours of service to the college and community, which included a few nursing scholarship fundraisers, assisting their peers in the open lab, planning for the launch of the peer mentoring program, and the 3rd professional development Ask a Nurse panel event. Exemplify core values of the National Student Nurses Association include advocacy, leadership and autonomy, professionalism, diversity, care, and quality education. These following graduates will be recognized as a part of the Student Nurses Association board. Names will be read by Dr. Janice Miller.
Riley May, President. Kathleen Krieger, Vice President. Maria Villagomez, Secretary. Leslie Soto, Treasurer. Algina Ginny, Event Planning Fundraising Committee Member. Melissa Gutierrez Garcia, Student Mentoring Ambassador Chair. At this time, we would like to congratulate the recipient of the Academic Excellence Award for the 2020-2021 academic year and recognize and announce our special Daisy Award recipient for the spring class of 2021.
I'd now like to announce the recipient of the Award for Academic Excellence. Each spring, one student from the academic year is chosen to receive the Award for Academic Excellence. This year, the recipient is Erin Stafford. Erin graduated in December 2020, and she was very familiar to this class. She served as a GSG for this group, and we congratulate Erin on her award. I would now like to introduce the inaugural Daisy Foundation Award for nursing students. What is the Daisy Foundation? The Daisy Foundation is an acronym for Diseases Attacking the Immune System. The Daisy Foundation was founded in November 1999 by the family of J. Patrick Barnes, who died at age 33 of complications of idiopathic thrombocytopenic purpura. The nursing care Patrick received when hospitalized profoundly touched his family, and the family started this foundation in his honor. Traditionally, the award recognizes outstanding nurses in the clinical setting, and now we can also honor an outstanding nursing student. This year, the nursing faculty has voted and decided to give the award to Anthony Badway. Anthony Badway has been a stellar student academically and has shared his knowledge and passion for the profession of nursing with many of his peers. Tony currently serves as president of the Row chapter of Alpha Delta Nu. He has also been a peer tutor, guided study group leader for 3 semesters, and has helped many students to be successful in their courses. He also inspired many other students to become peer tutors. Tony is changing careers. He is leaving a successful career in business to make a difference in the world and the lives of others as a registered nurse. Tony knows what it's like to be a patient, and that guides his desire to be a compassionate nursing professional. Please join me in congratulating Tony on receiving the inaugural Student Daisy Award at the College of DuPage. Tony will be receiving a certificate, a portfolio for the certificate, a Daisy Foundation pin, and a Healing Touch sculpture. Congratulations on your award, Tony.
At this time, I would like to recognize our graduates. The traditional candle or lamp lighting commemorates Florence Nightingale's history of helping wounded soldiers at night by candlelight. I now invite Dr. Lorinda Dixon to lead in the reciting of the Nightingale Pledge. Will all nurses in the audience please join our graduates in reciting the Nightingale Pledge?
I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. I shall abstain from whatever is delirious and mischievous, and shall not take or knowingly administer any harmful drug. I shall do in all my power to maintain and elevate the standard of my profession, and will hold in confidence all the matters committed to my keeping and all family affairs coming to my knowledge in the practice of my calling. I shall be loyal to my work and devoted towards the welfare of those committed to my care.
I would like to thank all of you for joining us for this wonderful celebration of accomplishment. Welcome to the nursing profession.
Now I invite you to sit back and enjoy best memories with the May class of 2021. Thank you, everyone. Please stay safe and healthy, and God bless you.